Hello, welcome to the TanzmED. In this video, we are going to take you through what is available on TanzmED. Basically, TanzmED is a mobile app which is the access to the healthcare and the health decision support tools. So what we are trying to do, we are combining different health specialties in one application. As you can see, the TanzmED now is available in Swahili language, as you can see, but it can also be replicated in any other language. We've used Swahili language because it's the most widely spoken language in Africa. So let's get started. To get started, as you can see, this is the front page of the app, whereby you can get Ushahuli. This part you can get consultation from the specialists, and the consultation you can get for yourself or you can do for your friends. This part currently it's just using the normal analytical method, and but very soon now we are doing the AI feature, which will just be using natural language processing, whereby you can just speak and the tool will just know everything. So let's get and see what you can do. For example, you can just go here and you just do your age. For example, I'm 40. Then I can just add email. It just get my details, which I've already registered with, and then I can continue. Here I can just add my symptoms. So based on symptoms, for example, I can say homa. Then when you are writing, homa endelevu, maumivu, this chini ya kitovu, kukojoa. I can add these symptoms, and after that it just it asks me if there is any other symptoms which I feel. So based on the previous symptoms you've added, the tools will analyze and will see if there is any other, because if this is suggestive or this is probable, this is absolute. For example, this is suggestive, so that's why it asks me other. Then I get other symptoms, and then it can ask if I have these risk factors. Then if these risk factors I have, then in the end it will just give me suggestion what kind of diseases and give me the next point to do. But in our new version, all this will be done using artificial intelligence, whereby to automatically recommend it from that tool. So that is feature number one, whereby for the suggestion, and it can link you either to the specialists or just link to the medical facility, something like that. Another one, this is Oroda. This is GPS powered, whereby you can access the nearest health facilities from your nearest to you. So make it be a hospital, dispensary, health center, any facilities you can just access. For example, I feel I'm traveling, or those people who are using ARV, they want to know maybe most of the, because of the discrimination, they don't want to get the medicine from the nearest point, so they want to find somewhere maybe in the village, so they can use this one to get the medicine or the nearest facilities nearest to them. This another tool, ujauzito. This for the pregnant women, whereby we do a lot based on you can use ultrasound, or you can use the previous due date. For example, this was the menstrual date, and once you add the tool, it will calculate and give you which trimester you are. It will give you when the good date, and will give you day by day the progress of the baby, and all of this one, it will also go notification by message. So each week you go, it will tell you this week what is happening, what the risk factor, what is to consider, everything. You can start a clinic here. If you go to the clinic, you can manage your clinic. Also, you can even add your partner, for example, a father for the baby. You can add, and he will be notified for every clinic. We just notify you which when the day of the clinic, and a lot of those details. And not only that, you can plan your delivery plan for in Africa and the many countries in Africa. Delivery is free, but you have to take some delivery items. For example, here you can see all of these here. For example, sizes. You can see like a pad, all of these items, you have to carry by yourself. So for those people in a rural area whereby the accessibility of these items is a little bit hard, so they can make a plan. Okay, this one already have, this one I already have, this one or pre their delivery day. So this is like a tool to plan your delivery. Where do you go? Who will you stay at home? All those details. Then you can just make delivery. And if you have any suggestion, you need to speak. You have any complication, or you have any sign of something which is not normal, you can speak directly to gynecology through this interface. Also, Dr. Kiteko, as I mentioned before, we are changing this part. We are adding artificial intelligence, so you'll be able to use to talk, because our AI tool will use natural language processing, whereby it will understand, and you can just chat, or you can just speak like how I'm speaking here. So that is the tool for the pregnant. We have another tool for the baby. We call it Total Clinic, whereby you can add the clinic for the daughter or son, and you can manage vaccination. We just take that clinic card, which are based on WHO standards. We have another tool we call it Healthy. Healthy means menstrual tracker. As you can see, this is just like a normal menstrual tracker, but we have added one thing, like because we wanted to add collaboration between partners. So a partner can add you can add your partner. For example, if my girlfriend is using TanzmED, she can add my number, and then if she add my number, also I'm on TanzmED, so I'll be able to see all the dates, all the evolution cycle for my girlfriend. You can see down here we have notification. You can get even by SMS. So we are sending this notification by SMS to notify on the every cycle of the menstrual. So even I can go home, I can see my girlfriend or my wife is moody, but that moody because the hormone changes. So by notifying them, the partner, we are creating happy family. And even if for people who are looking for the baby, I'll be able to know when is the good date. And even those people that don't want to have the baby, for the family planning, they can use this tool both. Sometimes women they forgot, but the men, if we remember, then you'll be able to access. We have the BMI calculator, which you can calculate you can just add your height and weight and be able to tell you, for example, if someone add, for example, my kgs is 76, 165, so it tell me I'm overweight. I have to reduce 7 up to that much kilogram. So that is BMI. But also our new tool using artificial intelligence will be able to utilize this tool. So you can see another tool is time for medicine. Here is where you can add the medicine for those people who are using medicine. For example, people using ARV. If you add for the ARV, we just tell you, because the people who are using ARV, you want to remind them when the day to go for the refill. So they just tell how many, for how long you have that medicine, which center you took, who is your secret person. So all those details, they're just being collected. And remember, we are tracking at the background. And here you can read articles which are written by the medical specialists. And all of these articles, the good thing, like you can read it even when you are offline. That's the good thing. For example, this is hepatitis article. Is written by Dr. Mayala, who is specialist. I can download this article and I can even read when I'm offline. You can see, and most of this article, see, this was being read by how many people? Being read by 10,000 people. So a lot of people are reading these articles, and as you can see, this one, Kanda Jeshi, you can see Dr. Fabian, is being read by 53,000 people have read this article. So most of our article are very, 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 even go to the Google, TanzmED, most of our article are receiving very high ranking in search. And I can even download all the articles here and I can read offline. Remember, TanzmED you can even access when you're offline. You don't need to be online to access the TanzmED. We have another tool here for VVU or HIV. This is a dedicated page for VVU and the AIDS. As you know, in Africa, this pandemic is still a big challenge, although we are going to 95, triple 95. So this one you can get consultation, Ushauri Nasa. You can get speak to the consultant. You can here we've partnered with one angel called it Tuamata. So that angel, the people they are dealing with the people who have HIV or living with AIDS. So they are giving a direct technical, medical, legal, and even financial support. So you can get all the support direct from there. You can get the nearest center to get treatment. There is another good tool here. This is very for youth. Also, we are redesigning this tool. You can analyze yourself. For example, you can analyze based on your behavior to see the risk of contracting HIV. So I'm just putting, for example, random. In our scale-up plan, we are planning to make this one more user-friendly. As you can see now, this is the result of my tests, which I put randomly, and you can see I have like 57% in the scale, which is kubwa, means like high percent, not very high, not dangerous. So mean like the orange is high, then based on that, it gives me suggestion, like I can go the testing facilities or the medical facilities. I can contact like a consultation person, or I can read more article related to VVU or HIV/AIDS, so that for the education purpose. So it just do everything here. The articles you can see, and you have another tool for the GBV, gender-based violence, whereby you can get, for example, the youth, the female, and it really focused to give the quick support whereby this group they need. This tool is we are working with the Ministry of Social Works here in Tanzania, whereby, for example, whatever you do, for example, I'm a youth, I need a support. So there are two types of support I can get. One, I can get by phone, or I can get by chat, whereby this one we are working on it now. And when I call by phone, then it calls this number, which is direct number for the Ministry of Health. But also we are raising fund for this part, and we'll be able to have direct call center whereby people they can call and they can be linked to the GBV desk, call it police, call it like the local administration area and something like that. So those are the tools, the TanzmED you can use, and you can go, for example, here, this is my profile. As you noticed there, after talking to our AI tool, maybe you might need appointment, or you might, for example, here we have the appointment tool, which you need GPS setting. If I allow location for this tool, let me go back. If you allow GPS for this tool, I can book appointment and the tool for the nearest from the nearest hospital. You can see this I recommended it, and it can even it show me which street I'm here now. I can go, I can book appointment. It's for free of charge right now. So here, for example, I want to speak with the doctor directly. We have direct consultation whereby you can do what called live consultation, or you can chat on WhatsApp if the AI, our tools, which it failed to give you a correct answer. Then when you go to my page, we have this point. And the purpose of this point, you can buy even using your insurance. This is why we are talking about the insurance company. Or we are making a way to redeem this point from different what we call corporates. So we are introduce the corporate scheme whereby people they can redeem this point maybe from their corporate. Let's say Vodacom, it can say all of our employee we are giving you 10 points we can use on TanzmED. Why? Because if the employee are getting sick, the meaning is less productivity. Also for the insurance company, it's the same thing. They can use this point. People they can use TanzmED instead of just going directly to the hospital. So that is a lot thing where you can do with the TanzmED. You see notification bar whereby it can, if there's any notification, it can just show there in notification. I think this video was informative, and thank you for viewing. I hope you have enjoyed the journey for TanzmED.